Okay, so good evening, everyone, and welcome to the 1907th uninterrupted daily webinar of the International Forum for Promoting Homeopathy. I am Arya. I'm a third year student at ANSS Homeopathic Medical College, and I'll be your moderator today. And it is an honor to be a part of this global platform that unites all the students, teachers, well-wishers, and friends of homeopathy from across the globe. And today we are delighted to host a remarkable personality in the field of homeopathy, Dr. Mukesh Musale, a young, dynamic, and passionate homeopathic consultant, counselor, motivational speaker, and recipient of numerous national and international awards. And today, Dr. Mukesh will be speaking to us on this very remarkable topic, that is the effectiveness of homeopathic medicine in neurological disorders, a simplified approach. Dr. Mukesh, uh, the dice is all yours. So, shall we start?
I can't see him. Who joined? Yeah. Your admin, isn't it?
So, there is an echo of the audio.
Okay.
Dr. Mukesh, shall we start now? I guess he hasn't joined yet.
There is some unmute.
Hello.
Admin, okay.
Am I audible now?
Yes, sir, you're audible.
Okay. Yes. Thank you very much, IFPH platform, for inviting me for this wonderful session. I'm Dr. Mukesh Musale, practicing at Nasik since last 15 years, Nasik, Maharashtra, India. And it's my really a very big opportunity for me to share my clinical case with all of you. So should I share my slide?
Sure, sir, go ahead. We'll see. Yes, we can see. We can see.
It's visible?
Yes, it's visible.
Okay. So we'll start our session with our guru, Dr. Samuel Hahnemann, who is a founder of homeopathy, and my living legend, my guru, Dr. Amartya Nikam. He is running his Aditya Homeopathic Hospital at Pune, 100-bed hospital. It's Asia's maybe the first hospital who is running since more than 30 years. And I am proud student of him. Now, today I'll be discussing a case of, this is my short intro, this is my profile. So my vision and mission towards homeopathy is, my vision is very clear: to empower individuals towards complete well-being through compassionate homeopathic care, mindful counseling, and inspiring education. And my mission is to heal holistically, guide with empathy, and teach with purpose, blending science, soul, and sensitivity in every consultation, cure, and class, which almost every homeopath is having a same goal, which is I am having. So we will move ahead with our today's case. It's a case of ependymoma, a lower grade glioma compatible with a fibrocytic astrocytoma. This is the diagnosis of the patient. It's a 21-year-old lady, which is referred to me by one of the reputed person of Nasik, uh, who said me that this patient is operated at Bangalore, very reputed hospital for this ependymoma. I will tell you, this ependymoma is very rare disease, and it's the origin of ependymoma is just near to third ventricle, and at the same time uh, it commences at L3 and L4 number vertebra, lumbar vertebra. This is the origin of ependymoma. So after operation, this patient landed into severe neurological deficit, and afterwards this case is referred to me. So we'll go ahead with the case. I will be sharing you with this case. I will be discussing with you the miasm of the case, how I interpret, and the takeaway message from today's case is what you are going to learn, or what I learn from this case, I will discuss with you. And the takeaway message is that this uh, how homeopathic medicine acts on these severe and pathological irreversible cases within a short period of time with the minimum potency, with very minimum doses. This is the takeaway message. So this is ependymoma. See here, you can see here, this is a tumor of ependymoma. At the same time, this tumor is commencing at this brain and spinal cord, just L3 and L4 vertebra. So facts about this case is, it's a very interesting because it's a rare tumor that grows in the brain and spinal cord, and really it's a challenging case for a homeopath, very risky to deal as a homeopathic neurophysician. You know, it's really very hard to take such cases and giving a result within a short period of time. It needs a consistent effort and consistent what we call is reading about our Mater Medica and Organon of Medicine. So what is ependymoma? Is a growth of cells that forms in the brain or a spinal cord. The cell forms a mass called a tumor, and ependymoma begins in the ependymal cells. So when I prescribe this medicine is having its sphere of action on ependymal cell. This is the main thought process while dealing with this case. So these cells line the passageways that carry cerebrospinal fluid. This fluid surrounds and protects the brain and spinal cord. So treatment in allopathy, the first treatment for an ependymoma is surgery if possible. So the word if possible means if it is advisable, then only a neurosurgeon can do this procedure, because that ependymal tumor is very near to the third ventricle and it is very risky to operate. The goal of surgery is to obtain tissue to determine the tumor type and remove as much tumor as possible without causing more symptoms. So this is not the treatment or the perfect treatment for ependymoma. So what is the pathophysiology? What happens in ependymoma? It's derived from the layer of epithelium that lines the ventricles and the central canal of the spinal cord. It occurs chiefly in childhood and young adulthood below 20 years of age. This is the commonest pathology. Typically, it is encountered in the fourth ventricle, posterior fossa tumor. It is a well demarcated tumor, but complete surgical removal may not be possible due to close proximity to vital structures in the medulla and the pons. This is the main line where allopathic peoples having limitations while treating such type of neurological diseases. But as a homeopath, we have the scope to treat such kind of cases. So what are the variants of ependymoma? Is a myxopapillary ependymoma and subependymoma. Myxopapillary, it occurs in the region of Cauda equina and originates from the phylum terminal in adults, while as subependymoma, it occurs as a small asymptomatic, incidental solid nodule in the fourth and lateral ventricles of the middle age or elderly patients. So you can see here, this is myxopapillary ependymoma. You can see here, these two. Cauda equina at the brain level and subependymoma here. You can see here. So this is all syphilitic stages. The miasm for this is syphilis. So see the percentage of ependymoma all over the world. as compared to other tumors is 5 to 10%. So it's a very rare tumor and it is a very challenging case to treat. So supratentorial astrocytoma, it's a high grade 10 to 15% and low grade 15 to 25%. Pineal tumors 0.5 to 2% are there, and medulla-blastoma 10 to 20%, as compared to ependymoma, and brainstem glioma is 10 to 20%, and other tumors include it's a 12 to 14% overall. This is statistical analysis by NIH. So ependymoma, 1098 people diagnosed per year, and 923 adults. So estimated people 13,294 living with this tumor, and many patients did not get any type of treatment, and it's they are living with the tumor with the tumor effects. See, this is the report of my patient. See, you can see here, investigation is a large, well-defined, altered signal identities, smooth, equilateral, heterogeneously enhancing intradural mass lesion appearing hypointense T1 and hyperintense on T2, likely from the occurs measuring 3.7 into 1.6 into 3.1 centimeter. This is the lesion, and the another one is this MRI is of 19th March 2024, and the follow-up MRI 35 2024. The large, well-defined, heterogeneously enhancing T2 hyperintense lesion in the cauda equina region, abducting. It's reduced in size as compared to previous one, and L3 and L4. You can see this investigation report. It's very minute. I can't maximize it. Okay, we will see the results in patient. So we will move ahead with the our today's case. This is all introduction part about ependymoma, what is the pathophysiology of ependymoma, and what are the treatment available in modern medicine. So 21-year-old female patient came to me having complaints of heaviness of limbs, numbness since 4 months, location hands and legs, numbness, aggravation dry cold air, change of weather, movement by touch, and emulation by hot application by rest. Pain in lower back since 4 months, location lumbar region, dull aching pain, aggravation by bending forward, stooping, emulation by hot application, and by lying down position. So patient is suffering from loss of balance, cannot walk and stand, unable to hold things properly in hands since 4 months. In urine, pressure while passing urine since 3 to 4 months. Location lower abdomen is more affected, and sensation is burning, not completed. So foot drop, right side lower limb, right to left shift of complaint, which is marked. It's an observational thing, as this case is taken by me on video recording, because patient was unable to walk, unable to stand, unable to move his upper limbs and lower limbs after operation. So at this position, patient has referred to me, and I took his case taking, and afterwards I prescribed XYZ medicine, and the results are within 17 days. It's an awesome results after giving homeopathic medicine. We'll see case further. Patient is a thirstless, desire for spicy 2+, aversion bitter plus and sweet plus. Thermally patient is chilly, food aggravation, sweet and sour. So this is my case taking approach, case receiving approach. The questions, how I asked the question is, how was your childhood? So I asked patient, and patient reply that I was born into a very poor family My parents worked as laborers on other people's farm. Since I was the eldest among my brother and sister, I had many responsibilities from a young age. So I worked very hard in my childhood. I used to help my parents in the farm, take care of my younger siblings, and still manage my school and studies. Despite all these responsibilities, I remained very sincere and studious. So my childhood was full of struggle, but it also taught me the value of hard work and responsibility. So this was her childhood. She explained me. My next question was, how is your nature? So she replied, as a child, I was extremely calm, quiet, and shy. But as I grew older, life struggle changed me. Now, especially after this illness, I have become very irritable and short tempered. The pain I face every day makes it hard for me to stay patient, and even small things trigger me. Since childhood, I have been an overthinker. Even today, my mind remains crowded with thoughts. Sometimes I get so lost in my thoughts that I don't even realize what's happening around me. This is the patient's expression. This is the patient saying, patient is uh, saying about her complaints. And I was recording, I was writing that complaint in her language. Obviously it was in Marathi language, then I converted into English, and then I took a rubric in rubric form, and within a few minutes or hours everything slips from my memory. It feels like my mind just gets blocked. Further, I asked, anything else you want to share? So she said, yes, doctor, nowadays I feel very frustrated and emotionally drained because of my illness. There is also one memory from my past that still hurts me deeply, as she had a one-sided affection for a boy during her school days. When that boy refused her, it broke her from inside. And she said, I went into a kind of a depression for nearly about 6 months. And those days were so painful, but slowly I gathered myself and healed. Still, that memory sometimes comes back and troubles me. Again, I ask, this is a general question from me. I ask to every patient that, what do you think about your disease? This will tell you very brief information and very precise information about the thought process of the patient. So patient says, honestly, I feel like after the operation, I have never been able to regain my old health. It feels as if something inside me has not healed fully, physically as well as emotionally. This was her statement. So my case is over here, and now I am going to show you how she was appearing before going to a disease state, during disease state, and during first follow-up, uh, within 17 days follow-up, then 1 month follow-up, and after 4 month follow-up, I'd recorded all these things. So this is her before started her disease. This was a picture, uh, and this is the picture before starting our treatment. That is after operation and after many steroidal medicines, her body becomes swollen, and she was appearing like this. This is the first follow-up of the patient. Okay, I will play from, just a minute. I will play video for you. That video is not playing here. I think there is a problem while this is the first video. After giving homeopathic medicine, she started just a minute.
Hello, doctor.
Yes.
Please add with audio that you share that video with audio.
Yes, this video is not here, but I have follow-up video. This first video after
Okay.
after
You can
17
open it.
days, she's walking here, and in
Is it
next
not
slide.
possible?
Sorry.
Ah. You open it.
This is the video after 1 month. It's not. I think I don't have a quick time player here. That's why it's not playing.
Okay.
But I
Okay.
will show you.
Then okay.
I will show you follow-up video directly in her language. It's a testimonial video.
Okay. With audio. Then only we can
With
hear.
audio. Yes, yes. Just a minute. Yes. Now I'm going to share with you her follow-up after 4 months. The patient who was not able to stand, was not able to get up from bed. She traveled almost 160 kilometers from the Nasik, and she came to meet me that how homeopathy, she is the experienced person, that after allopathic this operation, she was in a very big trouble, and she was not able to move her upper limbs and lower limbs, even fingers. But after taking homeopathic medicine, she can walk properly, and she traveled from this 160 kilometer and meet me after 4 months. This is after 4 month video. She's talking in Marathi language. I will translate for you that she was talking that I was a 21-year-old lady, came from Dharangao. It's a place, and she was suffering from ependymoma. And further, she's explaining now. She went to many doctors nearby places like Nagpur and Jalgaon, but she was not satisfied with the results. She was not getting results. When she started treatment at our center, and afterwards she got the confidence, then her lower limbs reflexes got recovered from our medicine, and she now can able to walk properly after this homeopathic medicine. Then I asked her to walk in my OPD, and this is her walk. See, you can see the ependymoma patient suffering from this ependymoma disease, and now she's walking within a 4 months of period. Still, she is having a slightly waddling gait, but she can walk properly. She can travel from one point to another only with the help of homeopathic medicine. So after this treatment, she regularly in every follow-up, she was talking to me, and she was begging me, doctor, please give me, please restore me the way how was I was looking before. And I I regularly asked her and counsel her that don't worry, you will definitely going to be, you will definitely fine after homeopathic medicine. And this is the after 4 month result of after our medicine. This is the restoration of the health. As if we follow our homeopathic principle, if we follow guidelines, if we follow Hahnemannian method, then we'll definitely going to get such type of results within a short period of time. And I uh, prescribed the medicine in potency is not the issue for us, because we practice in 30 potencies. So this was the case. Anybody want to share their views about case, or any totality or medicine? They are welcome. If it is possible for you, in chat box. Otherwise, we will move ahead and I will disclose my totality and my medicine. I think I will share my totality. So in this case, my thought process was, I observed patient was bedridden during first video call and unable to wake up from the bed, unable to walk properly, imbalancing while walking, and after operation, all complaints are increased. So during our conversation, she expressed a lack of faith in medicine, any form of treatment, was very reluctant to talk about her illness, and seemed hopeless about her recovery. This is my observation. And my totality is irritability due to pain, brooding tendency, timid, hopeless about recovery, as she was not having any she was not believe on any type of medicine or any pathy. So I took this. Absent-mindedness, elements from mental exertion and grief, thirstless, desire spicy 2+, aversion sweet plus, and thermally patient is chilly. So I prescribed on this totality, including aggravation and ameliorating factors. It's having heaviness of limbs, numbness, aggravation, dry cold air, change of weather, emulation by hot application, pain in lower back, aggravation by stooping and hot application, having characteristic of loss of balance, cannot walk and stand, unable to hold things properly in hands. She was having a complaint of dribbling of urination, but force slow. This is the rubric. And foot drop, right side lower limb, right to left shift of complaints was there. So this is my repertorial analysis. I repertorize this case, and the medicine was causticum. I gave her causticum 30 with repetition of dose. Firstly, at every 2-hourly repetition for 2 days, and then afterwards only if needed, then I asked her for repeat causticum 30, otherwise don't repeat, and the results are within 17 days. So my medicine was causticum 30. So why causticum? Because causticum is having its pathophysiological action is, it is a great polychorus remedy acting upon nerves, motor and sensory, and on muscles, voluntary and involuntary, of bladder, larynx and limbs. Weakness, progressive loss of muscular strength, causing increasing control over the muscles. So finally, it gets paralyzed of a single organ or a single part. This is a characteristic of causticum. This is a pathophysiological action, but I balanced the totality. I took mind symptom also. I took the physical generals, then aggravation and amelioration factor. Then I took elementary factor, and her thought process while during disease and before disease, I compared it, and then I prescribed causticum. The causticum pathology is on the central and peripheral nervous system and having a gradual paralysis. This is the characteristic of causticum. The main idea of causticum is paralysis following an initial phase of excessive hypersensitivity and overreactivity, which is observed after operation, because she landed into this this state after within 14 days of her operation, and then she contacted me within 3 days after operation. That's after landed into this situation. So this was my references from Kent's Repertory, Clark's Mater Medica, Allen's Keynote, Fatak Mater Medica, Complete Repertory, Synthetic Repertory, Organ of Medicine, Comparative Mater Medica by Dr. E.F. Harrington, the new research in manifestation of miasm, Dr. Nikam sir, and research in thermal mater medica by Dr. Nikam sir. These are all books which I follow, and I follow the guidelines of our Dr. Hahnemann and practice accordingly. I would like to share some more cases before and after results, how we can get evidence-based homeopathy or evidence-based medicine within a short period of time. If we follow our principles, we'll go ahead within a short period of time, if doctor permits me. Yes, sir. We have time. So this is my Dr. Manoj sir. We have time, right? Yes. Okay. So what is evidence-based homeopathy, which is having results within a few seconds, few minutes, and few hours? So here I am sharing a few clinical cases of mine. So this is a case came to me of angioneurotic edema. Before treatment, this was a case of doctor's son, who is a pediatrics, who came to me suffering from angioneurotic edema. Results within 7 hours after treatment. I prescribed lycopodium 30 and repetition hourly. I got the results within 7 hours. Then this is a ganglionic cyst. You can see here, this is a surgical case before treatment, and within 2 months after treatment, I prescribed Silicia 30, 5 doses per day for 7 days, and after 7 days, I did not prescribe any medicines. Patient was only on SL, and this you can see here, ganglion cyst. It is very risky to operate because recurrence is very common in ganglionic cyst. After operation also, we had many patients, they are coming after operation. So this is xeroderma pigmentosum. It's an autosomal recessive disease. In this case, I prescribed alumina 30 repetition after 10 days, and I got results within 10 days. So I would like to share that xeroderma is having an autosomal recessive disease, which is having action on if we prescribe a proper medicine in this case. So our medicine acts on chromosomal level, and that DNA repair mechanism takes place at that level, and that this xeroderma pigmentosa reversal takes place after giving homeopathic medicine. It's a case of a furuncle or a boil. I prescribed sulfur 30. You can see here furuncle before treatment, and within 12 hours, the furuncle is recovered. You can see here after treatment, and this is very fast and quick and gentle relief with homeopathy with sulfur 30. This is another case of very rare disease, Gerson Gopalan syndrome with plantar psoriasis, erythromyalgia, and hyperkeratosis. This patient came to me with which was having when she was walking, she was having very blood which is came out from her foot, and she was very frustrated for this disease. But after prescribing causticum 30, a repetition 3 to 4 times in 3 months duration, she recovered within 3 months with homeopathy. Before that, she tried more than 9 years in modern medicine, but she was not getting relief. This is a case of a PCOS with secondary infertility. I prescribed arsenic album 30. It's a constitutional medicine. A repetition 5 to 6 doses in 15 days, and I got results within 15 days. This is another case of tracheoesophageal fistula. As I am very helpless that this video is not playing here. It's a very critical case. Actually, tracheoesophageal fistula having results after giving antimutat 30 within a 72 hours, and this patient was having ASD, atrial septal defect, 7.7 millimeter on 1st of January 2021, and within next month after antimutat 30, ASD becomes 6.5 millimeter in size. This is the effect of homeopathy. I had another case of angioneurotic edema where the patient had a severe swelling over lips and below the eyes, both the eyes. I took his acute totality and consider acute miasm, and by considering this, I prescribed Kali carbonicum 30 in frequent repetition of 3 doses. I got result within 8 hours. You can see here, within 8 hours, his complaints got reduced after giving homeopathic medicine. These are very fast results which I got within 3 minutes. This patient was suffering from severe agonizing pain in his eyes because he had accidentally taken a eye drop, this ear drop, and put it into his eyes, and he was having severe agonizing pain. He was very restless while coming to my OPD. Then I prescribed him by considering acute totality. As you know, the aconitis, the symptoms are very sudden and very violent. So I prescribed by taking other thermals and all these things, and I got results within 3 minutes. So Dr. Hahnemann always talking about that this homeopathy is very gentle, safe, and very fast in acting. Is another case of epileptiform convulsions. Again, this video is not playing. Otherwise, I want to show you how the epileptic form convulsion child was behaving during attack, and afterwards, this is his testimonial. Within 3 days, she got recovered after receiving the Sina 30 repetition, only 2 doses, and afterwards, with the help of a neurophysician, I talked with him, and afterwards she was on Levipara, Levipil, and syrup Levipara, and we reduced tapered doses, and afterwards she was only on homeopathic medicine. Now I stopped homeopathic medicine also. She is very fine. This is a case of a corrugated nail or a crippled nails. You can see here is a yellowish crippled nails with a blackish discoloration in hands and legs also. So by considering constitutional medicine. I prescribed arsenic album 30 repetition 8 times during within a, I think 3 to 4 months duration, and I got results within 11 days. This is another case of leprosy, Hansen disease. So very risky to treat such type of cases because they are very restless, unstable, and the peripheral neuropathy is there. They can't sense the peripheral sensations. You can see here, I prescribed Sepia 30 repetition 5 times in 27 days. First dose repeated 3rd day, then 10th day, 15th day, and 27th day, and I got these results. You can see the results. See, he was suffering from this Hansen's disease, having a skin eruptions all over, and he was having a wound at his right leg. And this wound is completely restored after homeopathic medicine Sepia 30. This is before and after testimonial, again in Marathi, but video is not working. It's a case of infertility. In this case, it's a case of PCOS. She was taking, I think she had undergone 3 IUI cycle, but it did not work. And she was thinking about IVF, to go for IVF. But accidentally she came to me, and within 1 month, we got the result after giving Sepia 30. You can see here a single live intrauterine gestation, gestational age of 13 to 14 weeks in sonography. And she's very happy after taking homeopathic medicine. It's a case of a Down syndrome with mesenteric lymphadenopathy. Why I'm sharing this with you? Because we can have a scope in different pathological cases also. Many times youngsters like me, they're very afraid of taking such type of cases, and they don't know the scope, how we can tackle such type of cases. The only answer for this is just follow our routine activities, routine case taking activity. Involve yourself with that activity thoroughly. Read proper stalwarts and follow our principles. So we can get good results within a short period of time. It's a case of Down syndrome with mesenteric lymphadenopathy. You can see here, he was not having the hairs on his eyebrows, but after giving Calcarea Carb 30 repetition 18 times within a this duration 8 months, I got results within 3 days. You can see here development of eyebrows, hairs of eyebrows, and here also. This is a testimonial of a patient. This is chromosomal analysis saying it's a Down syndrome, and so before and after result of sonography, the first diffuse gallbladder with mild splenomegaly and mesenteric lymphadenopathy, and within 5 to 6 days we repeated sonography, and in sonography there is no lymphadenopathy. Mesenteric lymphadenopathy is recovered. This is a case of a Duchenne muscular dystrophy. I prescribed Causticum 30 repetition for 10 to 12 times. This case was brought to me from one of my good friends, and the history of this case is that in their family almost 8 death was there because of muscular dystrophy, and this was the patient 9th patient. So this patient is saved with homeopathy after receiving this Causticum 30. This is the follow-up video after 6 years. At this stage, neurophysician and orthopedics advise that he will not going to survive for more than 8 to 9 months because his disease was very progress at that time. But with the help of homeopathic medicine, this video I took after 6 years. Again, I got a chance to treat this perforated appendix, this acute appendicitis, which is very risky, again risky case. So you can see a dilated appendix with wall thickening and contagious circumferential cecal wall thickening with surrounding fat standing a fully appendicitis in mild appendix noted. So it's an infective etiology with appendicitis, mild ileocecal and terminal ileum, short segment wall thickening, and multiple enlarged non-echoic and ileocec and mesenteric lymph nodes noted. So I prescribed Lycopodium 30 according to his acute. I took an acute case and I prescribed Lycopodium 30 repetition 1 hourly for 2 days. And this is during treatment. The appendix is, this is the first report after our homeopathic medicine. The appendix is prominent, measuring 7 millimeter in diameter. Within a few small 5 millimeter appendiculosis in mild appendix, no periappendical fat reaction or collection, which was there in previous report. And now after treatment, there is no significant abnormality detected. This is a 17 June 2022 report after treatment. This is 27th August 2021, and it's August 21 to June 22. So this is the effect of homeopathy. And during this whole treatment, he was not having a single time, he was not having a pain at his appendix region. So this is his video after treatment, his testimonial. It's again in Marathi, but it's not playing here. In fact, I was not, I'm doing my job regularly, and I spread homeopathy not only to human beings, but I am giving medicine to animals also. I regularly prescribed medicine to dogs and buffalo and cows for their fertility, for milk fertility and milk production. So many times you heard that cows are getting oxytocin injections for their milk productivity, increase milk productivity. But we have our homeopathic medicine is having ability to increase the milk production. So I regularly doing these camps, animal camps also in my rural areas nearby Nasik, and I was having a good results in that. So what is the conclusion for today's session? Why we are here and why I am here to present a case of ependymoma to you. The thing is that what is my prescribing method is, I give importance to body language of the patient. I give importance to modalities, aggravation and amelioration factor, which guide us for proper selection of medicine. I give importance to complete symptom, grand generalization, and I give importance to the physical generals. Again, the thermals are more important. So by considering physical, mental, pathological, thermal and miasm, which gives us a proper simillimum. It's a, I know it's a quite hard process, but it is very easy if you practice. If you balance totality, then it's very easy to restore patient, not the cure. Cure is very simple, but to restore a patient is a uh, different task that Dr. Hahnemann said. It's a art of, as a homeopath, you should have that art to restore the patient. So what is the scope of homeopathy? According to me, we can avoid operative measures, we can avoid long stay in hospital, we can treat any types of pathological cases at OPD level also. Within we can give a single dose, or if required in acute cases, we need to we have to repeat dosage, but in chronic we can wait. It's a very safe and minimal potency. According to me, is a 30 with minimum repetition, and work in acute and pathological and irreversible cases. This is the scope of homeopathy, which I learned from my 15 years of practice. So this is all about my today's presentation. If anyone is having a doubt regarding case, you can ask. These are my students which help me during my day-to-day practice, and this is my mobile number. You can have, if you are having any doubt, you can ask me at by phone also.
Is there anyone who would like to ask any questions or say something? Please raise the hand.
Yes, sir. Meanwhile, we can stop the screen sharing, sir.
Yes, yes.
A nice person, no doubt about that, and it proves once again that the Hahnemann homeopathy is not out of date, out of fashion, but it's our problem. We always trying to modify homeopathy according to using some this so-called tautopathy medicines or some other new medicines. For example, in case of the COVID epidemic, unfortunately, if a few fellows from outside tried to prove that arsenicum is not effective because of their lack of what is
Knowledge.
the knowledge in homeopathic philosophy, because we are always using the similar medicine, not same medicine. So the use of this is vaccine, this no-sound is not at all applicable there, because we are always considering law similars. That simple logic is not at all, they never perceived that. That's an unfortunate thing. Anyway, your presentation is very nice one, and of course, this should be published in the newspapers and not in medical journals, because the medical plus they are always prejudiced. The
Yes.
consumers are in fact the common man, the patients. So this should be presented to the common man. Definitely that will benefit in the common man as well as the future young homeopathic doctors. Anyway, congratulations for your attempts. And I must add one point that you always gave the 30th potency. What is the logic of that?
Sorry, sir.
You always gave the 30th potency, am I right?
Yes.
What is the logic of that?
So logic is simple. Any pathological cases, according to even Dr. Hahnemann also says that Dr. Hahnemann was a prescriber in lower potencies. Afterward, Dr. Kent came and he coined higher potencies. So as a Hahnemannian follower, and according to my knowledge, 30 is the safe, and potency, according to me, potency doesn't matter. Even if I go for 200 or 1 m, but my medicine is perfect, then it has to be acted on that patient, because I know that I selected a portrait, I selected a same medicine which is sitting in front of me, the same medicine having same portrait in that patient.
But I have some, I think otherwise, because we all know that the medicine, dose, potency, and attenuation, these are the 4 factors that often determines the future of the case, as well as the potency, it is
So
not at all.
the thing is that if we are practicing at 30 potency now, so the first thing, we can change potency immediately because it is not acting deeply.
No. I am not at all mentioning about the using the 30th potency, but the follow-up and repetition always, I think some change of potency will be more beneficial than the same potency. That's my suggestion. Okay.
Okay. Okay, sir.
Okay, so is there anyone else who would like to ask any questions?
I think that all the medicines are approved in 30th potency. So we can, at the same time, we can think that it may act in 30th potency. That may be one of the reasons.
Yes.
But we should remember, we prove medicines in whom? In healthy persons. When it is applied therapeutically, it is in the diseased person. So sensitivity is different. So this is a fundamental principle of homeopathy, the drug dynamization. That is the advantage. So in fact, what is the discovery of Hahnemann is not homeopathy. It is the potentization, the single medicine, the character symptoms. These are the chronic disease. In fact, these are the novel things. The law of similarities was there. It was not a new thing. But these are the contribution of Dr. Samuel Hahnemann to the medical field. That we should forget of. Okay, thank you.
Dr. V. Karunagar, would you like to ask anything? You have sent something in the chat.
Yes, sir. But actually, it's a very nice presentation and giving inspiration to taken up in future such a type of cases. As a homeopath, afraid not only homeopathy is dare enough to take such a cases, but patients are not aware and they are not dare enough to come by overcoming allopathic people or modern people. But your way of recording and presentation is very nice. But as Manoj sir said, Hahnemann was used 30th potency for many cases, but he said directly the potentization theory, the higher potencies are more beneficial or like that in the 6th edition, all other things. Yes, okay, accepted 30th potency is used for in all cases. What about miasmatic theory? You are not using in chronic case. Hahnemann clearly stated that without removing, there is no possibility of restoration and curing the diseases, especially in chronic diseases. Even acute also, without using an antisoric remedy, there is no eradication or prevention of tendency of that recurrence. There is a possibility of recurrence is there in acute cases. In which aspect, what is your convincible answer to that one? And also one point I have to suggest, what Manoj sir said, not only in the clinical papers, wherever the modern people are competent or presented, we have to present such a way to create awareness and we have to publish or creating awareness. There is a scope of homeopathy in such cases. We have said irreversible cases also. But
Excuse
how
me,
we are
doctor, it's time to conclude. We have to start for the next session, please.
So we are out of time. It's already 9:30 and the
Only 1
Malayalam
minute.
session has to begin.
Only 1 minute. The
Sure.
answer for his first question is, for miasm, I selected a syphilitic miasm, and causticum is a tetramiasmatic medicine. So it acts on that particular case, in that case. And the second question was, if I'm getting results in 30 potency, 30 is the first dynamic potency, which is the potency to stimulate a deranged vital force and regaining or restoring the health of the patient. So if we are getting results within that 30 potency, then there is no need to go for higher potencies. This is my thought process.
Okay, please conclude.
Okay, thank you, sir. So we're going to conclude the session. I thank Dr. Mukesh, and also I extend my thanks to all of the participants who have joined in this webinar. Thank you and good night, everyone.
Thank you.